Good morning. Broadcasting live spine surgery from Duke Spine Institute. It is November 12th, 2024. I'm Dr. Duke Majan. Our patient comes from Norway. He has already had problems with his cervical spine, 2 herniated discs, C3-4, C4-5, operated on in Germany. And I hate to say this, but the craftsmanship has been very bad. Take a look at the x-ray. Jordan is going to point out the hardware. There's a metal plate. You can see it runs from C3 to C5. You can see the cages. Those are the cages. Those markers show you the front and back. Now, you can also see the screws are coming out. They're actually broken and coming out. There's a screw head right there. Those screw heads are supposed to be flush with the plate all the way in. But we've already seen earlier when we did this patient's Duke plasma rhizotomy that those screws are sticking out. And one of them at the bottom, they only put 1 screw and they're supposed to put 2. I think they had some trouble. The plate is too long. Show us the bottom of the plate. Show us the bottom of the vertebral body. See the vertebral body line right there, the black line, front to back? The plate is literally against the bottom of the vertebral body. When I do ACDF fusions, the proper technique is to put the bottom of the plate up where Jordan has the arrow, way up there. And the top of the plate, look at the top of the plate, it's actually covering the disc space at C2-3. Should not be. The top of the plate should be all the way down to where the arrow is, where the screw is. So they put too long of a plate in. Too long of a plate. They didn't put the screws in properly. This is just poor craftsmanship. So anyway, long story short, we're not here to fix the plate and screws. We're here to take away his pain from the disc below. He now has adjacent segment disease. It happens in patients with fusions. Whether or not the hardware is put in properly, patients get these issues. He has 2 discs below his fusion that are now severely degenerated, and we're going to try to give him some relief of his symptoms by going in and repairing those 2. Any way to make his neck more supple? All right, so we're going to give a little more muscle relaxer and try to get him as loose as possible, his soft tissues, so that I can manipulate them, push them over. His prior surgery was done on the right side of his neck. I'm going on the left side. It's better to go on the opposite side because there's less scar tissue scarring the structures together. So the only thing I need to do, it's not an easy surgery, it's a very hard surgery, but I need him more supple so I can push it over, his neck and soft tissues over to get to the spine. If you have questions, feel free to type them up. We are streaming on 6 platforms now. Henry, you want to tell us what platforms we're streaming on?
Of course, we are streaming on our typical YouTube, Facebook, LinkedIn, and Twitter, but now we just added Instagram last week, and today we just added Kick to all of our streaming platforms.
We're trying to stream on Truth, but we can't seem to find a way to do that. I guess they don't have stream.
Yeah, for right now, things can change though. So
all right. If anybody has any suggestion of other platforms for streaming, we'll be happy to listen.
Please do.
You ready? All right. I'm going to give this another try. We're going to push things over. I need to get to the spine. I need to get around the trachea, esophagus, as well as the carotid sheath and its contents. This is the hardest part of the surgery. And still pretty rigid. I'm going to give it another minute, and then I'm going to, let's just see where we are, Jordan. I need you to really give me the best relaxation you can, because he's, unfortunately, with that prior surgery, got a lot of scar tissue. All right, so I need to be a little bit lower. Yeah, let me know when you feel he's maximally relaxed. If there's any questions, feel free to type them up, folks. First part of the surgery is to use a needle, go through the skin, through the front of the neck. This is the front of the neck on the left side, right side here. I'm going on the left side. His face is here. He has a tube coming out. He's asleep and he's relaxed. We're going to make him a little bit more relaxed. This surgery is done basically, huh?
I don't have any twitches right now.
0 twitches? Seems a little more supple. All right. I don't think we need a shoulder pull. I don't think we need any inline. Let's just He does feel softer, but let's see if it's enough. I feel the spine. That's a good start. So I need to be medial to the carotid artery and carotid contents. Shot. All right, give me just a minute, folks, as there's a lot of scar tissue from the plate from his prior surgery. Definitely making it very difficult for me. That said, I think we can still do this. So, shot. 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 AP. Quick. All right, lateral. Shot. Shot. Is that it?
Yes, sir.
Give me an AP. That's pretty good, lateral. You can see the plate is actually off. Shot. All right, we are right in the front of the spine. Shot. I need to try to find a way in. It does have a bone spur. You can see. Shot. AP. Coker. Hold on. Let's get a good clean AP. Shot. That looks pretty good. Actually, it looks really better than I expected. That's good. Take this. This, by the way, is the hardest part of the entire surgery, folks. The hardest part. So I appreciate your patience with us as we get into the disc. Shot. Shot. Well, we got lucky. Shot. We are inside his disc, which is exactly where we want to be. Shot. Now I've just got to finagle this back to the back of the disc. There's a lot of scar tissue. I feel it. This is what happens, unfortunately, with adjacent segment disease. When you get a fusion or an artificial disc in your neck or back, the next disc, I could use some inline now. I'm going to ask for inline traction. My anesthesiologist will pull and give me some gentle traction so I can advance this needle. Shot. Very nice. Stay there. Man, a lot of scar tissue. Incredible. Incredible. All right, well, that's good. I need to do a discogram. Thanks for sticking with us. We are now below his fusion at the disc below. That's where we want to be. Number 2, 3, 4, 5, 6, 5, 6. Everyone agrees, 5, 6, yes? And shot. All right. The dye is not showing our typical tear. Shot. Really hard to get the dye out. Shot. All right. I'm going to try to clean this a little bit. There may be some scar tissue. Shot right where the tip is. Shot. But definitely an abnormal disc. Shot, very degenerated. Shot. And I can feel inside the disc there's a lot of scar tissue from chronic inflammation. This disc has been inflamed for years. Yeah, shot. We are not going to get much dye out because of the scar tissue, so we're just going to have to proceed at this point. It looks good otherwise. Give me an AP. Let's just double check. If you have questions, type them up. But we are entering the number 5-6 disc. And once I'm finished with this one, I will proceed to the 6-7, hopefully. Looks good. You can see we enter the disc in the midline. Show us where we enter. Right. Well, show where the needle enters. Yeah, that's right in the middle of the disc, which is what we want in the front. We're off to the foramen on the right, which is what we want. You can see the metal plate It's missing a screw at the bottom. I don't know where that screw is. I guess the surgeon forgot to put it in or didn't want to put it in. But honestly, this is some of the worst craftsmanship I've ever seen. Even 28 years ago when I was doing fusions, my work was far better, far superior. So it's not a surprise that he's developed so many problems. If you have questions, feel free to ask. Otherwise, we're going to show you a little video on the 30 different causes of neck pain, because there are 30 causes of neck pain, chronic neck pain. I'm making a 4mm incision, and now we're going to remove the needle, leave the guide wire, so that we can access the disc through the front. Feel free to ask questions, just type them up. I will answer them during surgery for you. Meanwhile, Henry, if you could show us 30 causes of neck pain, and then we'll see you back.
Copy that.
I'm Dr. Duke Majan, CEO and founder of the Duke Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3, next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury to the capsule, will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Duke plasma rhizotomy is the best treatment in the world available for painful facet joints. Duke laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes of chronic neck pain. Welcome back. You can see we've made some progress here during the surgery. You can see the dilator. Jordan, show the audience the dilator. It is literally 4 millimeters wide, the incision we used to do the surgery. This is the future of spine surgery. You're watching it today at Duke Spine Institute. We are leading the world in this surgery. Nobody else is able to do this type of surgery. It's too complicated for them. They don't have the right equipment or training, but this is the future. There's no need for metal. There's no need for plastic, no need for cadaver bone. We're not fusing. We're not putting anything unnatural in the spine. This type of surgery was devised by the Koreans, South Korean surgeons, neurosurgeon, Dr. Sang-Ho Lee, along with his team, including Dr. Gun Choi. They're the ones who trained me. The laser debridement, which we're about to do, is a Duke Spine special. We created it, I pioneered it, I published it. We're the first in the world to do it, and our success rate at eliminating neck pain today is 99.6%. Pain is eliminated with this surgery, 99.6. All right, we're doing inline traction. I need it for just a little longer. But this disc is severely collapsed and degenerated. I am back as far as I can go. Let's see what we've got, folks. Remember, we just treated his facet joint, and now we're treating the discs. I know we have a bunch of questions, so we'll take them.
Copy that. These first questions
Before you ask the question, by the way, this is all the blood we've lost for the whole surgery. This is all we're going to lose. Not only does this surgery done with the smallest incision possible, humanly possible, but also no bleeding, There's no hospital. This patient will go home an hour after surgery. Home. In this case, since he's from Norway, he's going to be going to his hotel. All right, let's take some questions.
Alrighty. These first few questions are coming from Raj on YouTube,
Hi, Raj.
asking, why do some people have pain? Some people have numbness, and some people have spasms with the same diagnosis. Why are the symptoms different
Irrigation.
for each patient?
Well, that's a great question. There's no irrigation here. Okay? I need irrigation.
Check if it's all good. All the clamps are off. Check the line, please. Okay.
Give us 1 second as we try to troubleshoot our...
Check the line. There we go. Yeah, it's coming. Okay.
Well, what was the issue?
The line is a little contaminated.
All right. Raj, the reason why people have different symptoms is they really don't have that different symptoms, okay? When you have a problem with the disc, first of all, you've watched the video, 30 causes of neck pain. I want you all to understand a few points. Number one, the vast majority, the most common cause of neck pain by far is a disc problem like this patient has, okay? There are many names for the disc problem: degenerated disc, bulging disc, spondylosis, stenosis, protruded disc, extruded disc, slip disc, bulging disc, sequestered disc. They're all the same problem. They have different names, but they are all the same problem. Okay, they're all the same problem. Do not get confused. In the end, treating them, they'll all get the same treatment. So it doesn't matter what the radiologist calls them, they're all the same. As a matter of fact, the disc is very simple. It has a wall around the disc, which is called the annulus fibrosus. And that wall is made of collagen. It's soft. It's like a tendon, basically. Flip. Now, when that wall is torn, which always happens in every disc injury, the jelly in the center, called the nucleus, will squeeze out. Little pieces of it squeeze out at a time, and every time pieces come out, it starts inflammation in the back wall. When you ask what causes the symptoms of a herniated disc, bulging disc, extruded disc, it's inflammation. Okay? Inflammation is always the cause. The question is, what does the inflammation cause in terms of the patient's perception? What did this patient experience? Now that's where it's the same but also different, okay? First of all, it's the same in that inflammation in the back of the disc causes neck pain, pain to radiate from the neck into the shoulder, pain radiating down the arm, and numbness, tingling, and weakness. Why? Because nerves transmit signals, electrical signals. Those signals go to your brain, and your brain interprets those signals as pain, weakness, numbness, or tingling. 4 things: pain, weakness, numbness, tingling in the area of that nerve. Okay, it's very important, in the area of the nerve. So you can get neck pain, you can get pain shooting from your neck down your arm, pain shooting into your shoulder because the nerve passes through the shoulder. And you can get weakness, numbness, and tingling in your muscles and skin in your arm as a result of the nerve being affected. Now, what's affecting the nerve? Some people would say it's pressure on the nerve, but it's not pressure on the nerve usually. It can be, but it's usually inflammation of the covering of the nerve called radiculitis. And that's radiculitis, or inflammation of the nerve covering or nerve sheath, is what causes the pain down the arm. The weakness, numbness, and tingling in the arm are caused by pinched nerve, pressure on the nerve. So pressure on the nerve, weakness, numbness, tingling in the arm or leg, and inflammation of the nerve from the disc herniation causes the pain down the arm. Now, inflammation in the back of the disc also causes neck pain, headaches in some patients, and pain into the shoulder called cervical brachial pain. Those are the symptoms of a herniated disc in the neck. Those are the symptoms of a herniated disc, bulging disc, ruptured disc, protruded disc, extruded disc, slip disc. They're all the same. Degenerated disc as well. Pain in the neck, headaches, pain into the shoulder, pain down the arm, weakness, numbness, and tingling in the arm. Those are the only symptoms you can have. Okay? So, when you say, why do the symptoms vary so much? They're the same symptoms. They're just everybody experiences it differently because they have a different amount of inflammation, they have a different amount of pressure on the nerve, and they have a slightly different nerve pattern, innervation pattern in the extremity, to where, you know, we're not all exactly the same human beings. Some people have brown hair, some people have green eyes, blue eyes, red eyes. You like that one? And then people's nerve doesn't always go to the same spot, right? Some people it goes to the thumb, some people it goes to the middle finger, the ring finger. So there's some just diversity in terms of anatomy. But the pathophysiology of the disease, the mechanism of the disease and the condition doesn't change. It's the same. It's inflammation and it's pressure. Those are the two components, pressure and inflammation and time. All right, great question, Raj. Next question.
Next question coming from Lanu on YouTube,
Hi, Lanu, welcome.
asking, what is your view about scar tissue on any surgery?
Scar tissue does not cause any problems for anybody after surgery. All right, it is only a problem for like me right now coming back doing a second surgery. It scars the trachea and esophagus will be scarred to the carotid sheath. It increases the risk of complication because I need for this surgery to be done properly. I need to be able to push apart the carotid sheath away from the trachea and esophagus with my fingers. But if the patient's had prior surgery, like this patient, then there's scar tissue from the prior surgery that literally scars the esophagus and trachea to the carotid sheath. So they move as one. It's very difficult to displace them, to push them apart, which increases the risk of complications like perforating the carotid sheath, carotid artery, jugular vein, or vagus nerve could be injured. So complication rate goes up just because the exposure or the surgery that I'm doing is more risky. But scar tissue itself doesn't bother people. Scar tissue is a natural part of healing. Now, some people make too much scar tissue, right? We call it hypertrophic scarring or keloids. And those people can have like lumps and bumps, but they really don't cause any problems. Scar tissue rarely causes problems. When people have pain in their spine after surgery and they have scar tissue, the surgeon is basically saying, I don't know what's causing your problem. I can't fix it. It's scar tissue. That's because the surgeon has no way to fix it. They don't know what's wrong and they don't know how to fix it. Scar tissue is never a source of pain in the spine. Never. Next question.
Next question coming from Hassan on YouTube,
Hello, Hassan. Welcome.
asking, why do some surgeons you go from behind and some from the front, and what is better? I heard that surgeries from the front have hoarseness of voice. Is that accurate?
Hassan, great question. Thanks for joining us. First of all, you have to understand something. Not all surgeons are created equal. There are great surgeons, and then there's average surgeons, and then there's bad surgeons. Okay? Poor surgeons. Poor surgeons. I don't mean poor financially, just poor technique, poor training, poor ability. And the best surgery in the world for herniated disc in the neck is exactly what I'm doing now. It's from the front, it's through the disc, and we have never had a patient with hoarseness, dysphagia, odynophagia, recurrent laryngeal nerve injury, nothing. Zero complications, zero. And I've done now over 1,000 of these surgeries on the cervical spine. 1,000 anterior cervical transdiscal endoscopic procedures, the Duke laser disc repair that we're doing now. Okay? 1,000. And we've never had a complication. So the safest surgery in the world is exactly what you're watching. However, you will not find another surgeon in the world that can do what I do. That's because my technique is exceptional. what we do here is exceptional. It is very difficult to do. The surgeons don't have the training, they don't have the skills, they don't have the staff, the support, the equipment. They don't have anything that's necessary to do this surgery. They will never do it in their career. So if you want the best, you come to Duke Spine and get the best treatment, which is this surgery, anterior transdiscal. Now, if you say, well, Dr. Duke, I can't come to Duke Spine, I just want to know for other surgeons, what's better? The answer is really, what is your surgeon most comfortable doing and what do they have the best results with, right? I'll give you an example. If you are fighting a war and your enemy is over there beyond the hill and you have a sniper on your side working for you, you're the general, you have a sniper. If you give that sniper the wrong tool, you give him a sword and you say, go and destroy the enemy, the sniper will get killed because the sniper cannot use a sword. They don't have the training, the skill, the expertise to attack with a sword. On the other hand, if you give the sniper a rifle and give them proper concealment and support, they will take down many of the enemy with the sniper rifle if they're positioned properly. Okay? So you have to say, what is this surgeon good at? If you try to force the surgeon to do a procedure they're not good at, then you're going to have a catastrophic result, very bad result. You may have the best sniper in the world, but if they're using a sword, they're going to die and they're not going to be very effective. You will lose a very important chess piece in your game. So you must have the best surgeon with the best technique, and that is what you get here at Duke Spine Institute. This is the best surgery in the world for a herniated disc. There is nothing better. And I have done all the surgeries. I am the ultimate warrior. I can shoot a sniper rifle better than anyone, and I can wield a sword and ride a horse into battle better than anyone because I've done it all, and I've done it all for many years. So when you have the ultimate warrior, what does the ultimate warrior choose for their weapon? They're going to choose the weapon that best suits their need at the time, okay? And right now, with a cervical disc herniation, this surgery is the best in the world. There's nothing better. If there was, I would be doing it. Next.
Next question coming from Rita on YouTube.
Hi, Rita. Welcome.
Saying, good day, doctor and all. I've not been doing too well. Since you are a surgeon, do you ever recommend anything instead of surgery for us high-risk patients, plus ones who unfortunately can't get the funds for help?
I understand, Rita. I understand. Rita, I don't know what your problem is, and I can't discuss whatever your problem is publicly with people around it. In the United States, it's against the law. It's called HIPAA, and I want to respect your privacy. So I will not refer to you any issue you have personally as specific to you, but I will speak in general terms. If your problem is a disc issue like this, there is no other surgery or treatment in the world that works except for this surgery, Duke laser disc repair, or fusion surgery. Now, if done properly, but I don't recommend it. So when you have the disc problem and disc pain, the best treatment in the world is disc surgery. There is no shots, there is no therapy, there is no medicine that works because the pain will never go away without anything except operating on the disc. That's why we do this surgery. If there was another way, we would be doing it. That's less invasive. I would do it. If there was a therapy or acupuncture or cupping or horse serum, something that worked, I would do it because I don't want to do surgery on people unless it's absolutely necessary. And unfortunately, when it comes to disc problems like this, it's necessary. Okay. I don't know what else to tell you. There is no other treatment that works besides the surgery for disc herniation, bulging, extrusion, protrusion that's causing your pain. Shot. I am now removing the tube and dilator. I'm going to leave. I'm taking the tube out. The tube is 4 millimeters wide. The incision is probably 4 or 4.5 millimeters wide. Shot. I use the X-ray machine to guide me because I can see the spine and the tube. Shot. You cannot really see the disc. The disc is a empty space there. Shot. Now the reason he has a little more blood than most patients because he has so much arthritis happening in the disc. And remember, arthritis is inflammation. Inflammation brings blood. That's why when you look at a pimple on your face, shot, the pimple is red, pink red, because it's full of inflammation, blood supply, circulation. There's a lot of blood moving around under the skin. Well, there's a lot of blood moving around where the inflammation is at the back of the disc. That's why he has some bleeding. Okay, we're going to take this dilator out, and I'm going to move it down to the next disc. Hopefully, I may not be able to achieve this, but I'll do my very best to do so. I'm going to use the X-ray to do it. Just give me a moment. It all depends on how much scar tissue is here. If I can't do it, it's because of the scar tissue from the prior surgery, and I am worried about that. I don't want to harm the patient. I want to help him, but with all this scar tissue, it makes it very difficult to move the around the front of the spine. Shot. All right, so I'm just gently coming out. Shot. All right, just wait. All right. Give me a second, Henry. Shot.
Not a problem.
This is incredibly difficult right now from all the scar tissue, and you can see the bone spurs. They make it even harder for me. Shot. All right, so I am still in the front, and I'm a little bit to the right. I'm going to move to the patient's left a little bit. Let's see where this puts us. Shot. Yes. Lateral. You can see we're out of the disc and we are moving south towards the next disc. I'm going to try to get it. So far, everything is going very well for this patient today. Just about done there. Shot. Yes. Perfect, perfect, perfect. I need an AP. Get the mallet ready. Yeah. Yes, perfect. We're right in the middle. That's the middle of the spine. I'm very happy with that. I will need a little inline. Let's see if we can get in. We're not out of the woods yet. All right, I'm a little bit low. It's not bad. This will be one of the hardest I've ever done. If I can get this. I don't need that. I don't need the chin. Shot. I need just to cantilever this down so I can aim up. I'm running into his clavicle. Shot. That is the problem. Shot. I need an AP. If anything, I need him flexed in the beginning, not extended.
Okay.
I'll tell you when. Let's just make sure we're still in the midline. Yes, perfect. Lateral. I need him flexed a little bit to help bring some of the soft tissue south so that I can redirect this dilator upwards. Yeah, a little more flex. Shot. Almost there. Shot. Yes, almost. Another millimeter. Shot. Give me just another second. Almost there. Shot. Shot. I felt it go. All right, that's it. AP, quick. Let's just hold on. Nobody move. Keep him flexed. I'm not ready for his extension. Yes, perfect. Lateral. Nobody said spine surgery was easy, folks. Nobody said it was easy. It's very hard. That's why it's left for the best doctors, the neurosurgeons, Orthopedics are only doing it because they want some of the action, but it's a neurosurgical field, in my opinion, for the most part, this type of surgery at least. Unfortunately, it's hard to get neurosurgeons to change what they do and to advance and do new things without massive commercial interests and kickbacks for the neurosurgeons, which I have no ability or will to give kickbacks for doctors to do their job properly. Doctors should do their job properly without getting a kickback. All right, we did it. That was on a scale of 1 to 10, that was a 13. That was one of the hardest I've ever done. For those of you who cannot appreciate this, this is the clavicle right here. All right, now he's got a nice neck, but he has all that scar tissue from the prior surgery, which makes the soft tissues very difficult to move around so I can get into the disc. Plus he's got a steep angle down towards his feet with the disc. Plus he's got bone spurs in the front of the spine. And he's got this clavicle that's high riding. So we're very lucky and fortunate that we actually got this done. We're going to get the tube in next, and then we're going to do the laser surgery. This will be done in 12 minutes to 15 minutes. Put it on. No, just put it on. Any questions, Henry?
Yes, we have
Sean?
a question coming from Rita, once more on YouTube,
Yes, Rita.
saying, is the outcome on the back worse the more scoliosis with disc protruding and arthritis severe? 2, car accidents in Takayasu, knee also chondromalacia, excuse me, of the patella, forming bad pain and back, hip, knees. I've just had a few infections, hard to fight. Nobody wants to help, just meds. I'm trying to get my MRI. I did get done, but they charged. I'm not working, unfortunately, but I'm trying so I can see your opinion. The other doctors would do my hip and knee. You have, correct?
Yeah, so just so you understand, we want to help you, and we don't charge any money for our MRI review. It's free, okay? Free for everybody in the world. Why? Because I'm able to help people by doing a free MRI review. I can give them a diagnosis, what's wrong. And they're going to get the most important thing that they're going to get from any doctor or any person, which is answers. What is causing my pain? I will tell you exactly what's causing your pain. However, fixing it, we cannot do for free. Because if we're doing it for free, then I'm paying for it. And if I'm paying for it, I don't have the money to pay for it. I'll go bankrupt. Because these are very expensive surgeries to do. And we don't have the ability where we are to do free surgery for anybody because we have no donations from anyone. Now, if you get Mark Zuckerberg or Elon Musk or Jeff Bezos to give some money to Duke Spine, then we could set aside the money and we can do some free surgery for people that are indigent, that don't have the ability. I would love nothing more than to do that. But right now, free surgery for you would be me paying for it, which I can't afford. The expense is too great. So, that said, you have scoliosis, you have all kinds of issues. We can fix your pain, period. And we don't need to do scoliosis surgery to fix it. Pain comes from disc, facet, SI, joint, and piriformis in the lower back, period. Nothing else. All right, that's 99% of pain coming from the lower back. Disc, facet, SI, piriformis. There is no other cause of chronic back pain besides those. Scoliosis does not cause pain. Spondylolisthesis does not cause pain. Fibromyalgia does not exist. Okay? It's a made-up diagnosis for doctors who can't figure out what's causing your pain. It's the worst diagnosis there is because there's no cure for fibromyalgia. It's just take pills. That's it. And that's wrong. People should not have to just take pills. Okay. So this disc is extremely degenerated. This is all scar tissue and calcium. All right. What is that? Well, scar tissue comes from inflammation. So yes, this patient has had massive inflammation for years at this disc. Massive. I'm almost done. And that inflammation has not only destroyed this disc, but it's also caused all the structures to calcify. Look at this gold color down there. It's calcification. So we don't like calcification. It's not supposed to happen here. It's not a problem other than it just represents the fact that this disc is so scarred together. It's almost impossible for me to do this. What's wrong?
Oh, yes, dilator. These two back.
Is there something I need to know, or are we good? All right. Any other questions?
No current questions, but we do have comments coming from Rita once more on YouTube saying,
Sure.
I appreciate watching all that you do. I have referred you. You did meetings with people I know. I do think you are the best. That's why I'm trying to get to you. That's why I refer you. I do understand you can't do free. I wish I could get those people to donate.
Yes, I don't want to charge anybody anything. Nothing would make me happier. Nothing. And let me just tell you, running this business as its CEO is the hardest part of my job. Getting the insurance companies to pay, fighting them, to do what they're supposed to do, to pay for people's medical care. And I can't do it alone. It's impossible. I need people to help. But people don't help because they don't understand the insurance companies are cheating them out of their medical care. Less than 5 minutes, B, less than 5. How's my irrigation, by the way? Good. You sure? Yes. All right.
We have another comment coming from Rita once more on YouTube saying, I have been diagnosed fibromyalgia since '94. I believe pain started, never stopped, unless pain meds.
Yeah. Unless what?
Pain meds.
Yeah.
I think, yeah.
Rita, you don't have fibromyalgia, okay? I can promise you that. You have a curable problem that's causing your pain, just like everybody else. There is no such thing as fibromyalgia. I hate to say it, but it is the God's honest truth. This broadcast is not about lying to you people. It's about giving you the truth, the 100% truth. I have no interest in lying to people. I have no shame or fear of saying the truth. The truth is the truth. I have been taught and brought up, I'm 54 years old, I've been taught and brought up to tell people the truth. I'm not afraid of the truth. So I have no reason to lie to anybody. I have zero reason to deceive anybody. I'm just telling you, by the way, I don't even have to work. If I don't have surgeries, I just stay home and garden. And that's something I love to do. So I'm only here because I want to help people get better, get out of pain. That's it. The truth is, people have to take responsibility. They have to act. You have to fix our government. Our government is the problem. The insurance companies are the problem. If we were paid on every one of these surgeries like we should be paid, we would have a surplus of money available to treat people like Rita, people that don't have the funds or insurance to cover the surgery. And there's nothing that would make me happier in life than to not worry about money and keeping our business going every day. But it's hard. I don't have that luxury. It's not in my cards, unfortunately. I have to ask people for money. My team has to ask people for money. Now, I'll tell you this. My church, they just announced they raised $85 million from the parish to build a new facility, all right, for the churchgoers. And I asked myself, isn't what we do here at Duke Spine worth some money to some people? The answer is obviously yes, because people do come and they pay. But why do churches, why are they able to generate enough money to build new buildings and do projects when we struggle every day? And I know that in my heart this is God's will. God wants it to be this way. I believe that. Who am I to challenge what God wants? So I accept the struggle every day. I accept the struggle and I come to work and I try to keep our company going and keep the business and the doors open. I will never sell our company to investment companies, investment bankers. Why? Because they always are sending me letters to buy us, and I say no, because I don't want this to become a for-profit business in the sense that they put just money ahead of people, like all these other companies that they buy. They lie to patients, they trick them into having treatments like spinal cord stimulators just to make more profit. Even though those treatments don't work, they're dangerous for patients, they're not in the patient's best interest, okay? I don't do that, and I will never want to sell my company to people that are business people and don't care about human beings the way I do, okay? So yes, money is an issue, it's a problem. It's a problem that I hate. I don't like it. Doctors like me don't like to deal with money, but we have to, otherwise we go out of business. And then if I'm out of business, I can't help anybody, right? There is no Duke Spine. Who's going to do these procedures? Who's going to help people get out of pain? No one. No one. So, huh? How much do you have left? Because I'm done in like literally a minute. Huh? All right, good. Thank you. Yes, Henry.
We have one other question coming from Diana on YouTube.
All right, Diana, I'll take it.
Asking, what do you think is best? What do you think is the best course of action for we patients to get insurance companies to stop paying for antiquated surgeries and start paying for your services?
Diana, thank you. Great question. I've asked myself the same question a million times. I think the answer is, number one, you have to talk to your insurance company, okay? You have to talk to your adjuster. You have to call them and talk to them. Number two, sometimes we have to sue them. We have to just literally take it to the court and let the jury decide. You know, that's the best, that will work if we can get there. The problem is the insurance companies have created laws that protect them from the courts. And so it's very hard to take them to court to get a jury to decide if their surgery should be paid for. But that is something we're working on. We're done. The other way to do it is politicians. Politicians like senators, congressmen, they are the way to get these procedures covered. Here's why. Unfortunately, politicians write laws. They're called lawmakers because they write laws. But unfortunately, writing laws is difficult. And so they get elected, they have no idea how to write a law. So what they do is they allow these people called lobbyists to write the laws, and then they just sign off on them. What they don't understand is the lobbyists work for special interest groups like insurance companies. So when the laws are written, they're written in the favor of corporations that pay the lobbyists, hire the lobbyists, like the Tobacco Corporation, for example, or the guns and firearm corporations, Smith and Wesson, or in this case, insurance companies. You must watch a movie. It is a great movie. It will teach you a lot if you haven't seen it. It's called Thank You for Smoking. Thank You for Smoking.
That's a good movie.
Right?
Yeah.
Go watch that movie. Thank You for Smoking. It will teach you about the lobbyists and how they work. They literally control the politicians. They get the politicians to write laws that favor insurance companies. And the big thing here is something called denial. Denials are when the insurance company refuses to pay for a medical treatment or diagnostic test. And I will tell you this, the denials, when I was young, 40 years ago, the denial rate was 1 million denials in the United States per year. 1 million denials per year, 40 years ago. Now we have 2 million denials a day. All right, has the practice of medicine changed that much? No. What's happened is the insurance companies having unregulated, unbridled, unchallenged ability to deny anything they want. And all they say is that it's not medically necessary. It's experimental. That's all they got to say, experimental, not necessary. So what they did was they took these old drug laws, all right, when the drug companies used to come in and they would invent a new drug for cancer or something, and they would say, hey, let's have doctors prescribe it, try it out. and it was experimental. It was an experimental drug because they didn't know if it was going to work or not. And so they would try to get the insurance to pay for the experimental drug. The insurance would say, no, we're denying paying. It's experimental. And yeah, all right, so they have a good justification. But they took that experimental loophole where they can deny experimental treatments for drugs, and they've applied it to all of medicine now over the last 40 years, where you could have a brain tumor, and they're saying that brain surgery is experimental for the brain tumor. That's crazy. But they can do it because there's nobody to challenge them. There's no court, there's no committee, there's no board of medicine, there's no nothing. They just deny. And so that's where we are today. Insurance companies deny because they want to deny. They don't want to pay. Think about it. If this treatment works that I'm doing, more people will want it. And that means the insurance company will have to pay for more surgeries. Well, surgeries are expensive. So they're going to end up spending more money. They're going to have less profits at the end of the year. Less profit is bad for them because they're profit driven. So there's your problem. You need to talk to the politicians. You need to hold their feet to the fire. You need to make the politicians write laws that take away the insurance company's ability to deny treatment. If they want to deny something, put it into a committee, and the committee cannot be controlled by the insurance companies. The committee has to be made up of regular people that have no secondary gain. They're not bribed. They're not paid off by the insurance industry. And maybe half are doctors, half are lay people. And those people need to make the decision whether they agree the insurance company can deny that treatment. And then there needs to be punishment when the insurance company denies treatment and it harms patients. So the insurance companies will become disincentivized, financially punished, or criminally punished for denying treatment to patients, denying coverage of treatment to patients when it's deemed medically necessary. That's the key. But nobody's ever created that system. And I'm looking at Trump and I'm looking at Rick Scott. And Trump is thinking about making Rick Scott the what? Oh yeah, the head of the Senate. And that worries me because I don't trust Rick Scott to represent people's best interests. Yes, he's a Republican, but that's the guy, I don't know, a lot of people have short memory. He was running HCA Hospital when he was convicted, or HCA was convicted of Medicare fraud. They were committing fraud with the federal insurance to get extra payments for the hospital. He was the CEO of HCA. He had to step down because he was in charge of that. And now he's our senator and running for the head of the Senate. I mean, we need honest people that really care about Americans and want Americans to get the best medical care and not be in the pocket of the insurance industry. That's what we need. So there's your mandate, folks. Get your politicians to do what they're supposed to do. Represent your interests. All right, I'll take any other questions in the conference room. Go ahead and type them up. We're done. Everything went well. We'll talk about it when I get there. Let's go ahead and show everybody one more time 30 causes of neck pain if we haven't done it already.
Copy that.
I'm Dr. Duke Majan, CEO and founder of the Duke Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3. Next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury to the capsule, will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Duke plasma rhizotomy is the best treatment in the world available for painful facet joints. Duke laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 Causes of Chronic Neck Pain. I'm Dr. Ari Dugmajian with the Duke Spine Institute. We have a patient who just had surgery yesterday. And if you were tuned in online watching our live surgery broadcast, you saw her get 2 discs fixed in her neck. She's had a prior fusion done with an ACDF and a metal plate, so we fixed the disc above the fusion and below the fusion. She had adjacent segment disease. And how long were you suffering with neck pain and right arm symptoms before you came to Duke Spine to get it fixed yesterday?
Over 20 years.
Over 20 years.
Over 20 years.
And you had the Duke laser disc repair done. You can see we had to make 2 incisions on the front of your neck. How do you feel after the surgery you had yesterday?
Awesome. Never felt like I've not felt like this, and I couldn't tell you how many years. I've not been able to actually have a normal life due to the pain. Hurting so bad, having to lie down during pretty much after lunchtime.
Do you still have that pain right now?
No, sir.
It's gone.
Gone, yes.
Yeah, your neck is still a little stiff, and you
Yes.
got to get used to that. But you did have the fusion, fusions always cause neck stiffness, and we can't fix that. But the pain we can fix. So the pain you had before is gone.
Yes, sir.
You happy?
Very, very happy. That's an understatement.
Now you have a funny accent because you come from Bluff City, Tennessee. Isn't that right?
Yes.
All right. And why did you travel to Florida for your surgery?
Done a lot of research, and then I found you. Thank God. Greatest blessing that I've ever had. Best doctor I've ever been to in my life.
Thank you.
I can't really put into words how I feel. It's beyond. It's the greatest blessing ever. It truly is.
Well, I'm glad you're doing well. I know your husband is here. He's been very supportive. He was here throughout the surgery yesterday, and you can actually see in the video footage that we made 2 tiny little 4mm cuts in the front of your neck, went down through the neck, not damaging anything inside, and getting to the herniations where the tears were. And actually, you could see the tears on the discogram that I did. And they were big, and we were able to get in there and clean out all the herniations with the laser, and we didn't have to do fusion anymore. We didn't make your neck any worse than it came here with. And the nice thing about the Duke laser disc repair is it's a stabilizing procedure, getting rid of pain and neurological compromise. I checked you today. You came to us with weak arms, and now you have normal strength in your arms just 12 hours, 24 hours after your surgery.
Yes. Not had that in so many years. So many years.
All right, well, is there anything else you want to say to your fans out there?
Anybody suffering with chronic pain, you have no idea. It is well worth coming to see. Like I said, he's the best doctor I've ever been to in my life. He actually cares. First doctor I've ever had in my life to hug me and ask me how I'm doing.
And compliment you on your nails.
Exactly. He loves my nails.
I
He
do
loves
love
my
your
nails. Highly recommend him, like I said. Very well worth everything. He truly does care. And the team here is awesome. The nursing staff, everybody was tremendously impressed enough how everybody was so good to me and just went out of their way to make sure that I had everything I need. I was comfortable. You know, it was just a very wonderful experience. It truly was.
And I appreciate you sharing. You also had the Duke plasma rhizotomy, I just remembered, because she had facet joint pain as well as the disc problem. And she was having pain turning her head to the right, weren't you?
Oh yeah, I couldn't. I was having extreme pain. I was turned into when I couldn't hardly turn to my right. It was going down into my right arm extremely bad.
And that's gone.
Yes.
Amen. And it's gone permanently. So I'm very happy for you. When are you heading back home?
Saturday morning.
All right. Well, enjoy Florida for a few more days. You take care of yourself. You've got my phone number if you need anything.
Yes.
All right.
I thank
take
you
care.
so very much.
You are more than welcome. It's my pleasure to take care of you.
Even with my funny accent.
All right. Let's get you out of here, okay? Go enjoy the beach or something. Good morning, I'm Dr. Duke Majan. I'm here with one of my patients who underwent surgery yesterday with the Duke laser disc repair on his cervical spine. And he's here less than 24 hours from his surgery. And how are you feeling today?
I'm feeling great. No more neck pain, no more arm pain.
So you came to us here at Duke Spine because you were having neck pain and it was going in your right arm and it was affecting your work, your quality of life, right? Tell us about that.
I first started noticing a lot of arm pain and a lot of weakness in my right side arm, and that's my dominant arm, so I knew something was going on. And then finally I went and saw my primary care, who took me to a MRI, and that's when I noticed that I had some issues going on. And he referred me to Duke, and I'm very pleased that I didn't have to search around. I was real confident from watching all the videos and testimonials that I would be the right choice.
Yeah, and you can see in your surgery here, we made a tiny little cut on your neck in 2 spots. 4 millimeters, because you had 2 discs that needed to be fixed or were separated. And we used the laser to remove the herniations along with the endoscope. We did an annular debridement, cleaned up the tear that was there in the back of your disc. Everything went really well. You didn't have to have a fusion, did you? I mean, that's what most doctors will tell their patients. They need a fusion or an artificial disc.
Correct. I didn't have to get the aggressive plates put in. I'm real happy that it was just 2 little holes. That's it.
And it was outpatient.
Yes, I was home laying on my couch within an hour after the surgery. So
Within an hour. Yeah, that was nice to be able to recover at home.
Yeah.
Not have to go to the hospital.
Correct.
Well, is there anything else you want to share with your audience?
My wife and I both came in a little nervous yesterday, and the staff just comforted us and very professional, very caring, explained everything from the beginning to the end. We were very pleased that we chose this route.
So what's life look like for you now that you got these symptoms gone?
I'm hoping to go sit on the beach this afternoon.
And you will. Very good. Congratulations on taking it and doing so well.
Thank you.
All right. Have a nice day. All right. I hope you enjoyed that testimonial as much as I did. And we are just finishing with this patient who traveled all the way from Norway, where the northern lights are beautiful to see, and he is now here in Florida, the state with the best beaches, right?
Amen.
And Duke Spine Institute, of course, and NASA. So we're finished. We've done 2 procedures. He had not just the 2 bad discs below his fusion, he also had facet pain. And we treated his facet pain first with our Duke plasma rhizotomy. It's the only plasma rhizotomy in the world. It's a permanent elimination of facet pain. All the other doctors out there treating facet pain will offer you radiofrequency ablation, which is not permanent. It's temporary, but we offer permanent treatment here. And we've just completed the endoscopic transdiscal Duke laser disc repair on his left side of his neck. This is exactly where I put the cut. It's 4 millimeters. We went in with a little tube and to the back of the disc where all the arthritis was. It was a mess back there. You could see it. It was a great struggle to get there, but we got it done, and I think he's going to do fantastic. So we'll see. We have any questions from the audience?
Yes, we do. We have about 2 questions as of now. First one coming from Rusty on Facebook.
Hello, Rusty. Welcome to our broadcast, our live stream. Thank you for joining us on Facebook.
Asking, I've had a bad T8, T9 leftward paracentral protrusion disc herniation for 2 years, and nobody's touching my back. But y'all, when I somehow get the surgery, how long would it take me to heal from my type of surgery?
Rusty, T8, T9, no problem. As long as the disc is a soft herniation, which I expect it is, we can fix it for you. it will take you literally 1 hour to heal up. You can go back to work the next day. It's done with a 4 millimeter incision, could be a 7 millimeter, just depends on how big the disc and the herniation are. I'll have to use my judgment in the operating room, but basically tiny little cut, tube, endoscope, laser, same way we just did the cervical, but instead we come from the side on the back. We've done thoracics before. You can watch them on YouTube. If you just go to our playlist on our YouTube channel, you can look up Duke Laser Disc Repair Thoracic Spine. You can watch some thoracic DLDRs done. The recovery is literally an hour, and then the next day you can go back to work. With the thoracic spine, you don't have the same restrictions and limitations that we give people with the lower back, the lumbar, or the cervical. That's because the thoracic spine is generally more stable with the ribs and the sternum. They wrap around, they give more support to the spine, so you don't have the same restrictions. However, I don't know if you're like a bodybuilder, you know, like Lou Ferrigno or Arnold Schwarzenegger, and you squat 1,000 pounds, but obviously you cannot do that extreme squatting, lifting in the gym. But most common activities and work are generally no problem the next day.
Next question coming from Diana, once more on YouTube,
Hi Diana on YouTube, welcome.
asking, I was under the impression that the charges for your services are considerably less than those covered typically by insurance companies. So what in your opinion is the insurance company's bias?
Diana, great question. So Diana brings up a question we hear quite often, which is, I thought the laser surgery would be less than a fusion surgery. You are correct, it is. This is just one example of a fusion. You see the screws and rods. Fusion surgeries generally cost around $200,000 to $300,000 on average. And that's just an average number depending on what kind of fusion you're having, cervical or lumbar or thoracic. Cervical fusions are usually a little cheaper. Lumbar fusions are a bit more expensive. Just it all depends on how the fusion's done. But let's just pick an average number, $250,000. Now, the laser surgery you just watched would cost about 25 to 50% of a fusion. So it's cheaper, for sure. Now, here's what happens. The insurance companies know this. Let's say I recommend fusion to 10 people. How many people are actually going to go through with the fusion? 1 out of 10. So that 1 out of 10 will cost the insurance company $250,000 for that 1 out of 10 surgery. But let's say I offered the laser surgery and the cost was $50,000. Okay, it's a lot less than I said, 25 to 50%, but that's probably what it would be if the insurances were paying for it. 50 grand. Out of 10 people, how many will go forward with the surgery? Around 90%. So let's do the math. 90% or 9 people at 50,000, you're looking at $450,000 is what the insurance companies will spend. 450,000 versus 250,000 for the fusion. That's a lot more money. In other words, you guessed it, utilization of the services will go up because the surgery works and it's less invasive and better for the patient. The insurance companies know this. That's why they don't want to cover it. It's just better. Think about the insurance companies as selling you a meal plan. If they offer you a Camel hamburger for lunch and that's all they offer you, a lot of people are going to say, no thanks, I don't want a Camel hamburger. I'm just going to go down the street to the soup plantation or soup garden and have some soup or salad. But if they offered you a healthy salad, healthy soup, and nice burgers, everybody would go and use their meal plan, wouldn't they? That would cost the company more money. Insurance companies are evil, 100%, to the core. All they care about is profit. They do not care about you or their customer or beneficiaries. They hate doctors, they hate hospitals, they hate you. All right? The only reason why they're offering you insurance is so they can profit off of it. So for them, they're not interested in your well-being and safety. They just want the cheapest care possible out there. So everything they do favors inexpensive care. And when patients, they know behaviorally, will refuse fusions and just go with laser, they don't want to offer laser. I think I answered the question.
I believe so. Yeah. No current questions. So we do have a comment coming from Adam on YouTube saying, "I've been practicing fasting or periods of not eating for years and never had a problem doing it until I was diagnosed with cervical stenosis. Thank you for all that you do. I will be reaching out after doing an MRI. After I do MRI."
Thank you, Adam. Appreciate your comments, and thanks everybody for joining us. I hope this patient does well. I expect him to. He will be sore from the rhizotomy procedure for a couple of weeks. He heads back to Norway, I believe, by the end of the week. And the next patient coming is going to be a lower back, lumbar, Duke laser disc repair. It's the endoscopic procedure we just did on the cervical spine, but we're going to be doing it on the back. And the next patient comes from New Hampshire.
New Hampshire, yes, correct.
So he's traveling to Florida to Duke Spine Institute from New Hampshire, which is far up there in the blue states. And he's here for 3-level lumbar Duke laser disc repair. He has horrible back pain. It's on the left side. We're going to be treating the left L233445 disc. We'll try to do it with 1 incision and just retrajectorize our tube to fix 3 discs. So join us in about 30 minutes for our Duke laser disc repair. Our last patient of the day is coming from Texas, and he has 2 discs that are being repaired, L45, L5S1. We also had a knee patient who is having the Duke plasma rhizotomy for knee pain and knee arthritis, but we cannot get an IV in her, so we're going to have to probably cancel her and do her another day. She has no veins. Everybody's given it a try, and unfortunately sometimes we just cannot provide care if somebody has really bad veins. But generally we're able to get them, but in this one case we couldn't. So we'll be doing 3 surgeries today. We finished the first one. Actually, the first one had 2 procedures, so we did the first 2 procedures. We got 2 more coming. Thanks for joining us.